Thank you, Mike. I'd like to ask all of our speakers now to come up to the front and for all of you to think about asking some questions or making comments. Well, let me begin with a question while people are getting settled. And Wendy, this is for you. It's a relatively simple question, and maybe Richard as well. I believe there are over 10,000 technical dossiers on the European Union's Commission's website. Is EPA and is the NGO community making adequate use of that information? I was involved with several of those dossiers, and I know they tend to be fairly extensive, and I'm hoping that that information is being used beyond Europe as extensively as it can be.
We are making use of that information as much as we can. We look at it in terms of our prioritization process, and we've looked at it in terms of our risk assessment process. One of the issues that we've come up against is that it doesn't provide access to the underlying studies. And so when we're at the point of doing a risk assessment for a chemical, we can't really do that without having access to the underlying study and being able to look at that ourselves and then make it available to those who are peer reviewing and then looking at our risk assessment. So I'd say that's the major limitation for us in terms of that data, but certainly being able to look and see what's there and summaries of what's in a dossier and so forth, it's helpful in that regard.
I just add a couple of things. I think this is an area, for me, that followed REACH very closely from the outset, that's most disappointing, at least to date, in the implementation, is the fact that it's not delivering the level of data and access to data that we had hoped. There's a number of reasons. The formulation of these groups of companies that come together as a consortium to develop information has actually imposed a lot of constraints on the ability to share that information. And that's affecting EPA as well as public access. A lot of the studies a lot of the dossiers that were developed, one little piece of fine print in REACH was that you did not necessarily have to, if anything involved mammalian testing, you didn't have to actually provide the data at the time you registered your chemical. Instead, you provided a test plan for developing that information. And those test plans are slowly being looked at by the authorities and decisions being made about what information is to be required. But there's actually a lot less information today available than you might think by looking at a list of the endpoints that were supposed to be covered. That may be better in a few years as those test plans get carried out. And generally speaking, there's a lot of still unresolved issues around REACH and confidential business information protection generally that is still being worked through the European court system and through the agency and industry negotiations. So I'd say the jury is still out about the extent to which that will be the kind of source of information that we were all hoping on a global basis.
Thank you. First question.
John Balbus with the NIEHS. First of all, thank you all four for really informative, packed, and provocative and good presentations. I have a question that's triggered by Candace's presentation and is relevant to Richard's comment there. So Candace, you showed us slides about the review that was done, and the conclusion of the review is that everything that REACH was delivering, that REACH was felt to be very successful in its implementation, and Richard is saying, in fact, there's this gap between what he thought it should be delivering and what it actually is delivering. And my question is, in that review, were there defined indicators for the success of REACH? Were those indicators something that were thought of ahead of the review as part of the design of REACH? I'm not aware of that. Wendy, the same thing, and Richard, you showed the sleeping dog slide, which had some indicators there. Is there any effort to have some normative indicators for the performance of these so that we don't have one group, saying, well, it's really performing well, isn't it? Because we got X, and the other one has a sleeping dog slide.
Thank you, John. Let's remember that it's still early days. We're only 5 years into a process that could last 20 years. And again, thinking back to the pesticides legislation, entered into force in 1991, first decisions in 1999. There's a lot of work going on in the background. We're still, if you like, at the organizational stages and putting the frameworks together. A new agency had to be set up, started with 500 people. All of this work has been going on over the last 5 years, and this was factored in. Are there normative indicators? I don't know. I wasn't involved in that. But there have been several problems that are becoming apparent and, if you like, were predictable. One is in the quality of the dossiers that we received. The staff of the agency actually spent a lot of time chasing back the companies and saying, this isn't right, that's not right, this is missing, that's missing. And we really need to work a lot better with the companies to improve the quality of the dossiers. Having said that, I should also say that the industry, the big industry, has bought into REACH. It has turned around, it is supporting REACH, and it has more or less delivered what we would have wanted it to deliver. The problem, I had mentioned it in one of my slides, are these industry consortia. When you have to get all the producers around the table and all the users around the table and agree to produce a common dossier. This, personally, I had said at the beginning was, good luck. And for sure, this is a huge problem. It's only really the big companies have the capacity to take the leadership of such a consortium. And many don't want to take the leadership. And, well, the prices being charged for access are sometimes exorbitant. And this puts problems to the smaller manufacturers and the smaller users.
Thank you. And just to clarify, my question is not about the nature of the conclusions, but more about the process of evaluation. And whether, we know that in any kind of project, you should be thinking about the evaluation of it before you initiate it. And I'm just asking, to what extent was that done? And are there indicators that were agreed upon about how to measure the performance?
I just want to clarify, I'm still a big fan of REACH. And I pointed to one of the places where I think there's been a shortfall, if you will, in terms of at least the expectations. I think John's point is a good one, but I think many of the metrics around the pace of the program have been remarkably fulfilled. I mean, the rate at which, chemicals have been registered, the now review of those chemicals that's underway, the evaluation, et cetera. A lot of the benchmarks that were set for the pace of it have kept up. So it's a little bit different of a metric maybe than you were looking for, but they're on track to meet their 2018 deadline for registration of 30,000 substances roughly, and that's a remarkable achievement if if that last leg happens.
Okay, let's go to the next question, please.
Yeah, Denny Dobbin, the Society for Occupational Environmental Health. Thank you for a very informative presentation this morning. Enjoyed each of the papers. But we're missing one voice here. We have an industry perspective, but it's the management side. We don't have a worker perspective, and workers are exposed production-wise and also in use-wise. And I'd like to hear what they would have said if they were here. I can imagine if David Michaels were here from OSHA, that he would talk about a couple of things. One, about his inability to move standards, which he has like 400 or 500 standards that are personal exposure levels that are for chemicals and toxic substances that basically were set in 1968 by the ACGI HTLVs and then embedded in the Act and those are what are still being used pretty much. And he's had several initiatives. There have been several initiatives over the year to try to improve those, and those haven't changed. But meanwhile, the production of chemicals, the number of chemicals have grown considerably. And I think my friends from worker representatives would agree with Michael, actually, that they're happy about the production increases in terms of jobs. I mean, it really is important to them to have those, but they want to have jobs where they don't get sick from. And in chronic disease exposure, that's very difficult to figure out. But I think that they would also say that, in like with the old material safety data sheets, that there's often the data that were in there, the information that was in there was inadequate. I remember looking at it was actually a spill in California some years ago, metam sodium in the river. And I looked at the material safety data sheets from that spill, and the thing that was missing, which we found out later in the literature, was some information about reproductive toxicity. And it wasn't on the material safety data sheet. So there's gaps in there that I think we really have to pay attention to. And I'm hoping that REACH can do that. And a specific question I have to Wendy is on Section 8E with the significant risk. What could you say more about, as Don Clay would say, could you please hum a few bars about the effectiveness of 8E and successes we've had with it, and then what could we do to improve 8E, Section 8E? Thank you.
Well, there's always room for improvement in anything. I'd say 8E is maybe one of the more successful provisions in that it's a statutory requirement, so there isn't a burden on the agency to make the case for that information to be submitted. So we do get that information in. We find it useful. We make it public. One of the things we've come up against again is the degree of claims of confidentiality for data submitted under 8E. And so as we have looked at reviewing CBI claims, that's one of the areas. Health and safety studies, and 8E in particular, is one of the areas that we've focused in on, so we can make more of that information public.
Thanks. Jack Spengler, Harvard Roundtable member. I'm going to share an observation that I think the market is not waiting for regulatory reform. The U.S. Green Building Council is revising its LEED standards for buildings. And in that, there are options, credit options, that require the declarations of content, of materials that might be specified in buildings. So just to, Harvard is joining the likes, I hope Harvard is joining the likes of Google and Kaiser Permanente and Stantec and others that are market leaders in looking at these requirements for all their new building specifications, and even including red listed chemicals that they do not want in their products and in their buildings. So you might want to comment on that, whether that's misguided or not. But I had a direct question to Michael. One of the last things you said, wasn't even a bullet on your slide, was something that we need to have a better understanding of product flows in commerce. And maybe that relates to the observation I just shared, but I'd like you to amplify that.
Well, I think first of all, there's no doubt that the market is responding. I mean, we've seen several retailers, in addition to standards or private standards developers like LEED developing standards, or the U.S. Green Building Council. We've also seen retailers, Walmart and Target, have been developing one standard or another. I think that statement I made is sort of general, number one, but goes to a couple of points. One, we don't necessarily, and Richard I think also reinforced this point, we don't necessarily know where all major commodity chemicals are being used. So I think reform of the Toxic Substances Control Act helps paint a better picture, especially if we bring processors into that and require some appropriate level of reporting about how they're using a chemical. Manufacturer is not always going to know how the chemical is used. We have a very complicated supply chain in the United States for how chemicals are distributed and used. So we can do a better job of understanding how they're used. I think that the other element of it is to identify where that information then helps us identify where there may be concerns about potential exposures in particular uses. And that, I think, is information that's helpful to an EPA in prioritizing substances for review and potentially further regulation.
Next
I
question,
could-
please.
Yeah, oh, I'm sorry. Could I just comment on that last?
Yes, sure, Wendy.
Thank you. Just quickly, because this was part of my presentation that I had to zip through because I spent so much time on the front part. But I think that we really do need to look to the market to help us with this. Again, for the burden for EPA to go through and identify all of the uses and identify all of the potential risks and decide, what to take action on there, I think needs to be complemented by responsibility on the industry's part through the supply chain to be understanding what chemicals are in products and what we know and don't know about those products, and to drive us all to safer chemicals in that regard too. So I think there's clearly a regulatory need and responsibility and government responsibility, whether it's at the federal level or the state level. But I also think that there's a market responsibility there. So putting out standards, putting out information that allow industry and others to understand what they have and what they want to have and where they need to be doing assessment is really an important part of the overall picture here.
And without belaboring it too much more, Dennis, I'd just note that it's important for there to be some appropriate standards on how those approaches are developed, right? What are they looking at? I don't know the basis necessarily on which the Green Building Council might develop a red list, or Harvard, for example, but how do...
Yeah, USGBC will not, but others will.
Others will, and so, do we understand fully what the trade-offs might be, how those lists are being developed and then applied? So...
Thank you.
Hi, I'm Jonathan Hers. I'm an architect with the Department of Health and Human Services. These past two questions have sort of led into, I guess, I'd like to continue that same conversation. The reason all these toxic materials are out there is because people are buying them. And the people who are buying them are the designers who specified that shade of blue that expose workers to these materials, and it certainly was not the intent, I can assure you, for most architects. And so that's the way the direction the industry is going, is now when we specify a shade of blue, we also want to know through health product declarations what's in this blue so that we can avoid the damage that we've done in the past. And this goes into all aspects of buying, not just building materials, but also in the government. All the supplies and products that we get. And we have a huge range of discretion. And I know that this session is about regulations, but designers and purchasers don't need regulations before they go out and they specify something. And there was a problem that was identified early in the environmentally preferable purchasing program that had to do with EPA deciding to screen individual products as opposed to identifying characteristics. And that's really the direction that screening is going in now. So my question is, with USGBC going in that direction, with the FAROS is a tool for screening products, there's Cradle to Cradle. Those are the tools that people are going to be looking at and making decisions now rather than waiting for any great leaps in regulation. And I'd like to know, is the research community set up to feed information, for lack of a better word, to those to maintain the credibility, to avoid what is called the pick your poison approach to picking materials? And because it's very important, because it needs the credibility, but it also needs, it's started already, and we need to know all this information.
So I'd say a couple of things. First, I do think that the state of play under laws like TSCA is such that they haven't played the role they could or should have played to deliver the information that can inform all of those tools and all of those private sector efforts. So luckily, I think in the debate around TSCA reform, there clearly is an emphasis not only on how does EPA manage chemicals it finds risky, but how does it serve as a conduit for much more information getting to the market so the market can take care of a lot of these problems itself. The second thing is I would say that there's a growing recognition across sectors in the need to think about when you are taking a red list approach or whatever, what chemicals are going to take the place of those. There's a set of principles for safer substitution that I think one of our, Bev Thorpe will probably talk about, and Liz maybe tomorrow. There's a lot of effort. The Walmart announcement of its new policy included not only identifying some chemicals they were going to start trying to move away from, but also a process by which they would look at the alternatives to those chemicals that might take their place. So I think people are recognizing that need, and certainly the DFE program does a lot of work in that area, and that's a positive trend.
I just comment that I think one of our objectives in this area is to avoid regrettable substitution. And I know the state of California has set that as one of its policy objectives in implementing the safer consumer product regulation of how do we bring enough information forward so that we can make a reasonable judgment about what the potential impact of substitution in any particular case might be.
Next question, please.
Fayez Wajani, roundtable member in Shell. Most of the, or almost all of the large chemical manufacturers and many medium-sized chemical manufacturers work and across geography, therefore they are global. So they have responded to the REACH legislation in whatever way is required. When we look at the CSI or the Witter-Lautenberg, what are the key differences between REACH and what we currently see with the CSI? And what is the impact between the large and medium size and then medium and small size, which may have a geographic issue in terms of response to the TSCA refresh? Thank you.
Maybe Richard and I will tag team this one. I think the major difference between the two is REACH has a mandatory, basically minimum data set. The Chemical Safety Information Act does not require a minimum data set. It does require that EPA get an information sufficient to make a decision. So I think that gives EPA a considerable amount of discretion in individual cases. I think the other major issue is that the CSIA does not identify a list of substances of very high concern in the first instance. That is a hazard-based approach in which those chemicals are listed because of their particular hazard characteristic, and they may or may not move forward to use-specific licensing or authorization. Under the CSIA, EPA would identify particular priorities using a risk-based process, and then would do a risk assessment for those substances and make some determination about their safety under the intended conditions of use. So a little different structure, a little different legal standard as well. Maybe I'll leave it there. And maybe we can, just in terms of the impact, I think as was noted earlier, still a little early to tell. What we have seen in very few cases are where small U.S. companies who tended to be sole global suppliers of a particular chemical might have left the European market because of the, weighing the costs of entry into the European market under REACH. That doesn't necessarily mean the chemical was withdrawn from the market. Their customers may have taken up the registration obligation, for example. But I think those have tended to be few and far between. I don't think there are many examples of that. And I think the whole point of the CSIA is to leverage one of what I believe are the beneficial aspects of TSCA, which is a early dialogue with the agency to enhance innovation. There's a reason why EPA has reviewed, why only 50% of the new chemicals EPA has reviewed has been on the market. And that has to do with commercial decisions, but also, it does encourage a dialogue, gives EPA a window into what are some of the new and developing chemistries out there. So in my view, TSCA has helped promote innovation, and I think that's an element we want to preserve in TSCA reform. Sorry, I didn't.
No. I'll just point to one conceptual difference, and Candace's view on this might be helpful here as well. I think the primary thrust of REACH was this concept of shifting the burden of proof from government to show harm to industry to show safety. And I think conceptually, that's something I strongly support. How it gets implemented, I'm still very ambivalent about, because what it actually means under REACH is that the industry does the assessments, decides what risk management is necessary, and communicates that risk management through the supply chain. And that model only works if people have confidence in that information and the government's ability to make sure it's accurate. The CSIA takes a very different approach, which is to have government be the entity that does the assessments and decides on risk management. The reason the REACH folks went the direction they did in Europe is because of the sheer number of chemicals and so on, and that's something that is a major challenge, and maybe ultimately some kind of a hybrid model where certain chemicals rise to a level where government is the primary actor and other chemicals maybe at least start with an industry-directed process more like REACH might be a way to merge the two. But I do think that's fundamentally a different concept behind it. And I would argue that the shift that hopefully TSCA reform will bring about is the one I mentioned, from a presumption of safety, if you will, to an affirmative requirement that safety be demonstrated. Now, who does what in that is another dimension of it.
Let's go to the next question, please.
Hello, I'm Jerry Paulson. I'm a pediatrician at George Washington University Schools of Medicine and Public Health. I wanted to ask about the principles in REACH that relate to the protection of pregnant women and children, and if you could provide some details there. And then sort of to the rest of the panel, what do you look forward to in revisions of TSCA here in the U.S. that would apply to pregnant women and children? Thanks.
Okay. It's tricky, yes. You're getting very technical there. Basically, there's already a lot of test guidelines, OECD test guidelines out there to look at toxic to reproduction, for example, and so on. And these are in the existing legislation, but they're carried over into the new legislation. But as I said, or as I am saying, it's really for industry to show, not just from the hazard point of view, but from the exposure point of view. But one of the requirements of REACH is in prioritizing substances for evaluation. And normally we take a proxy approach. It's based grosso modo on the production volumes. But where you have labeling that something is possibly CMR, then this comes in already. We want the data now. So it comes into the first priority, even if it's a small production volume.
I'll refer to the administration principles for TSCA reform that talk about the need for chemicals to be assessed against a risk-based safety standard, and that assessment and safety standard must take into account susceptible populations like children, pregnant women. So I think it's very clear in the administration's principles for TSCA reform that that's one of the key issues that needs to be addressed.
Work our way down the line here. So I think the CSIA has the seed, and in other words, it does have information. It does have a requirement that EPA consider vulnerable populations. We are pressing for changes that would be more explicit in two regards. One is to be more explicit about what vulnerable populations are and how they're defined, and include, Jerry, what your the focus of your question. And the second is that there be a mandate that when EPA applies the safety standard to a chemical, that it not just consider those exposures to vulnerable populations, but it ensure protection of those vulnerable populations. So I think the seed is planted, but it needs a bit more to be germinating in the way that we need it to.
Okay, thank you. We have 3 more questions, it looks like, and we only have about 4 minutes, so can I ask you to keep your questions and answers relatively brief?
Sure. Liz Harriman with the Massachusetts Toxics Use Reduction Institute. I've heard a little bit about innovative state programs from some of the previous speakers, and also the difficulty of being able to take action at the federal level often. Can you say a little bit about your various thoughts on the provisions under the TSCA bill for preemption of states, and how you see that balance between preserving the states' rights to act versus creating a level, consistent message for companies at the federal level?
Probably go down the row again. My view is we need a robust uniform national system of chemical regulation. We set safety standards for automobiles at the federal level. We set safety standards for pharmaceuticals at the federal level, and there is still, in both cases, room for the states to act appropriately. Even under TSCA today, there's a waiver provision that allows states to seek a waiver from the preemptive effect of current TSCA decisions. It's never been used in 37 years. So I think that, I'd like to see predominantly a federal system with, and I think as in the CSIA, the balance is kind of struck right. Let's engage the states in the discussion around risk assessment and potential risk management actions around it, so that we can make sure that the decisions are made are protective across all 50 states.
So I would agree with Mike that a balance needs to be struck. However, I do think the current bill is out of balance and significantly preempts state authority to excessive a degree. I do want to say that I think we are dealing with the need for a strong national program. The state of Vermont has 1 toxicologist across the entire state agency. California is probably the other end of that spectrum. So we need a program that raises the floor nationally. But we need to make sure that states still have the authority to act where the federal government hasn't, and until the federal government does, and we need a waiver provision that's workable, that allows states to act where there are reasons for them to do so, even where the federal government has acted. The biggest concern I have about the bill is that it would preempt state action, new state actions, merely on the basis of a prioritization decision by EPA that a chemical is either low or high. And in particular, if it's a low priority designation, that action is not even judicially challengeable. So it's effectively a final agency action. It would have a preemptive effect on states, and I think that's a toxic combination. So while I don't disagree that, and one of the big drivers that got the industry to come to the table is the need for a national program, we don't have the balance right in that bill yet, and we're working to get it there.
I'll just say quickly that under current TSCA, states haven't sought waivers because we've regulated so very few chemicals. There really isn't anything they need to seek a waiver from. So I would just mention that.
And if I could have the last word on this. We Commission, or we EU, are regulating chemicals across 31 countries now. And if you think of the vision of going global eventually, and maybe having a transatlantic partnership or whatever in the longer term, we can negotiate with individual states. We would have to negotiate with the federal government. So from our point of view, it would be easier to discuss with one interlocutor rather than 50.
Okay, thank you. Next question, please.
First, I had a quick the Isla Cody EPA about REACH. My understanding in talking to Derek Knight at ECHA is that the dossiers will be publicly available, or at least versions of them will be publicly available. Is that correct? So one of the things we haven't discussed in the committee much is that if in fact we don't get, whether we get substantive TSCA reform or not, we're going to have public access to 30,000 dossiers on chemicals. And so that's a huge amount of information that could be applied through green chemistry or whatever. And I wanted to ask the panel how they sort of saw that evolving the use of that REACH data in the United States sort of independent of TSCA reform?
Look, that was, Isla, one of the really big promises that I think a lot of us felt about REACH. I think it has yet to be realized, and I mentioned some of the reasons for that earlier. Ultimately, the ability to have that information and have it be able to be acted upon by a range of actors was one of the real calling cards, I thought, of REACH. And so I'm hopeful that these bumps in the road that are limiting access and limiting the amount of information that's in those dossiers and that's being shared can be overcome, because it's a huge resource, and there's no reason to keep reinventing the wheel.
Wendy had mentioned in her talk, one of the biggest problems we have as regulators is what is CBI, and industry claiming this CBI. And the problem is not releasing the data to the public, it's releasing it to competitors. This is their big problem.
Yeah.
And it's something where we haven't quite found a solution yet.
Okay, last question, please.
Sure. David Andrews, Environmental Working Group. I just have a quick question in terms of the new chemicals. Just because I believe Candace had a slide that mentioned that one of the needs for REACH was due to higher regulations on new chemicals actually stifling innovation. And so the question is, with differing standards for new and existing chemicals currently existing under TSCA, is that, because there's really no regulations on existing chemicals, no new test orders. New chemicals, there's an increasing number of SNRs on new chemicals and increasing review by EPA. Is that actually stifling innovation? And so that's my question for the panel. Thank you.
Well, I assume Wendy and Richard will also have a quick view, but one, I think it depends on the particular SNR on whether it stifles innovation or not. There have been SNRs that have basically halted all further development in those areas. So it's I think circumstantial. I think that there is, in general, we would see the question of the impact of REACH on innovation is still very much out there. I mean, the Commission is still conducting a review. There is some anecdotal evidence. We still have, roughly around 3 times more new chemicals being introduced in the United States than under REACH. The different regulatory structures could be the major factor for that as well. So I think it's still too early to tell what impact REACH will have.
I'll mention what the significant new use rules require is that a company that wants to pursue the activity that's identified as a significant new use needs to submit a notice, like a pre-manufacture notice. So the SNRs in and of themselves don't impose regulatory requirements and so forth beyond the notice, similar to what the first manufacturer, importer, had to do to get that chemical on the market. And it's really leveling the playing field more than anything else. You have because of the way TSCA is set up, the first company coming through the gate can be, if we make the case that we need to make, asked to do testing and asked to put certain limitations on the use of the chemical pending the development of that testing. But anybody else without the SNR who comes through the door after them to make or import the same chemical doesn't have those requirements. So, if you look at the innovation being the creation and the application of the chemical to begin with, I'm not sure leveling the playing field to additional companies that want to piggyback on using that chemical is such a great thing.
First, I think it's important to note that REACH did not address the disparity between new and existing chemicals by lowering the bar for new chemicals. It did it by raising the bar for existing chemicals. Second, my own preference, if I were king of the world or whatever, would be to have a system that essentially required a universal SNR, that wherever EPA looks at a chemical and decides that it's safe under a set of conditions, that those conditions be encoded in some way that others would then need to comply with, and if they departed from those or wanted to, they would need to go through a process of ensuring the continued safety of that chemical. The problem has been that SNRs are kind of used, and some of EPA's own rhetoric has been a problem here, as a way to, deal with bad chemicals, when in fact I think a more universal approach would be preferable.
And sorry, not to just barge in to get the last word, but the point there, I think, though, the problem with a blanket SNR is that does inhibit innovation, because you've most of the innovation in chemistry is coming from chemicals that are already on the market, right? So.
Okay, please, we can. I'm sure these two will carry on into the future years regarding TSCA reform. Please join me in thanking our speakers for a very interesting and informative discussion. And I would ask you to be back here at about 1:15 for beginning at 1:20. Thank you.